Well, I am very excited today to introduce to you an amazing guest that I've had on my podcast, Life Changing Wellness. Well, how many of you deal with carpal tunnel syndrome, maybe tennis elbow, osteo or rheumatoid arthritis of the hands? Well, I want to welcome you none other than Dr. Alejandro Badia. He is a hand and upper extremity orthopedic surgeon treating orthopedic problems of the hand and the wrist. He is also the author of the new book, Health Care in the Trenches. Welcome, doctor.
Thank you, Dr. Bond. Pleasure to be here.
Yes, I have so many viewers as well as listeners that always deal with problems of the upper extremity. And, you and I have talked before, and I'm highly impressed with your knowledge. And at the same time, you kind of understand some of the natural ways of health, even though you're a surgeon. And
Yep.
what are some of the common problems of, let's say, upper extremities that you deal with for people over the age of 55?
Sure. Well, once we're over 40, the things change, right? And
Oh,
and so
yeah.
there are degenerative conditions. Maybe we don't want to use that word, but things that are just wear and tear of life. So the most common, perhaps, in the shoulder would be rotator cuff issues. So the rotator cuff, even though we all associate with athletes, and no, on the contrary, most rotator cuff tears happen to people now in their plus 50s because the blood supply to the rotator cuff goes. And by the way, I'm 3 months. I got to do my therapy today. I'm 13 weeks out of my surgery. And
Wow.
yeah, so these things are very daunting to people. But I can tell you, my surgeon wasn't happy. But I fixed two shoulders 2 weeks after my own rotator cuff was fixed. So these are things that really do have solutions. Other degenerative things that also happen actually in younger people is tennis elbow, which is a epicondylitis. It's a degeneration really of the tendon origin. And then there's all sorts of complex nerve compression issues that tend to occur also when you're a little bit older.
Well, what are some of those nerve compression issues?
So the most common one is one that most people have heard of, but I would tell you virtually nobody that I speak to really understands it. Carpal tunnel syndrome is a pinched nerve in your wrist. It's the median nerve that goes right here and provides sensation to the first four fingers and motor control of the thumb, which is so important for pinching, buttoning your clothing. And many of your viewers probably can relate to why they're having trouble not only feeling well, but doing manual dexterity with their thumb. And it has nothing to do with using a computer. That is what the big myth is.
Wow.
It is a hormonal metabolic issue, which is why some of the natural solutions in the early stages can work quite well. So it's an issue where the tendons around the membrane around the tendons called the tenosynovium gets thickened. And since that tunnel has a fixed diameter volume, when those tendons get thickened, there's less space for the nerve. What's the result? The hand gets tingly, goes numb, you shake it out, and people think they're sleeping on their hand at night or they think it's a circulation problem. It's none of those things. It is a pinched nerve.
That is amazing because for years when people talk about carpal tunnel syndrome, it's the repetitious work over and over again. And, a lot of people feel that it's a tendon problem. They get the pain in their hands. And, and you and I had discussed this before where in the very early stages, a lot of us can learn to do those, I call them an exercise, but maybe it's the massage of the forearm muscle down to the wrist, into the palm of the hand. But then as we get older, you're saying that there's this hormonal issue with carpal tunnel. And what type of surgery does someone look at if they need the surgery? Because, I hear about them, a lot of orthopedic surgeons go in and then they cut that white band in the wrist. Is that something that has to be done, or is there something that you've discovered to work around that to bring more effective results?
Well, I think you have to look at it this way. What has been tried and true for decades actually works well. The difference, and I'll tell you, it's not that new, but the difference now is we do it endoscopically, meaning if you don't have an incision in the palm, which you can imagine will be kind of tender, right? If
Right.
you do it through a little hole, just like we scope knees or I scope shoulders, there is really almost no pain. Uh, the question is who's candidate for the release, and that's people who fail conservative treatment, meaning you wear a splint, particularly at night, because at night when we dream, we go into this what we call decorticate posture. You flex, and you're putting pressure on the nerve. So you keep the wrist neutral. Vitamin B complex, the studies have shown that helps. We even use a CBD cream now. The cannabinoid receptors, people feel better. But if you have a real pinched nerve, the only way to release it is unpinch it. And the unpinching is very easy. It's not, you make a big deal out of it. I was telling somebody the other day, I did this on a cardiac surgeon who was in Fort Lauderdale for a conference coming from Arizona. He's a friend. He had me do the surgery on a Monday, which is my patient day, not surgery, but just so that he could make his conference. He has a surgery. He literally drove himself, which, close your ears, he shouldn't do that, but we gave him basically no sedation, just local anesthesia.
Wow.
3 days later, he was back in Arizona, and he sent me a picture doing a lobectomy of the lung with his dominant hand that he had the surgery on. He said, yeah, it hurt a little bit when he squeezed. The point is there's a lot of myths out there. This is a very easy, extremely successful procedure. It takes 10 minutes. And It's just a matter of the public education. The challenge is not the surgery, I assure you.
Well, ladies and gentlemen, as I'm talking with Dr. Badia, and, I have, read so much research when it comes to carpal tunnel or certain areas of arthritis that we're going to get into. And I love it, doctor, because you're making this sound actually easier. You're taking the fear away. I mean, I would have never imagined that a surgeon would have the surgery, 10 minutes is all it took. 3 days later, he's actually in surgery or using that hand. So I guess for a lot of people, recovery is pretty quick for the most part. But what is the average age of a person with carpal tunnel? And I understand too that you deal with more female patients with carpal tunnel than male patients. Isn't that correct?
Yes. Well, there's no question. I mean, if your female viewers may remember that during the third trimester in pregnancy, when they've got the swollen ankles and the back pain from the bloating and all these things, the tendons, the sheath around the tendons gets thickened because of fluid retention, which has to do with the estrogens, which act like aldosterone, which is a hormone that retains water from the adrenal glands of the kidney. So it has a similar effect. So when there's retention of fluid, the nerve pays the price. It's not a nerve problem. It's the nerve is affected by the tendon thickening, all right? And you see that in the third trimester of pregnancy, postpartum, it usually goes away. And then women will see it again around, some years before menopause. They'll start to get this. And then men get it too, but usually older. And one of the reasons they get it older is the truth is us men, let's get in touch with our female side, right? We have estrogens too, just like females have testosterone. And I know some who have a lot, by the way.
Well, yeah, well, I guess as we get older, as men, our testosterone levels start to drop,
exactly.
the estrogen start to increase.
Exactly. So then the older men will come in with carpal tunnel syndrome. Maybe their wives had it, many years before them, and hopefully had it, treated and resolved. Then they come in, and it's a no-brainer. The thing about typing and other activities, such as talking on the phone, you're bending, all of those things, what they do is they aggravate or they bring on the symptoms. It doesn't mean it causes it. There's a big difference, right? It's sort of like saying, every day I got to climb a flight of stairs to walk my dog. And boy, does my knee hurt. Well, when you get an x-ray with your orthopedist and you've got some, signs of arthritis, walking a Fido didn't cause your arthritis, but certainly doing a lot of walking will bring on the symptoms, right? So there's a difference between aggravation and causality.
Wow. Now, all right, let's move into something that a lot of people deal with, when they get, especially over the age of 50, 55, 60 and older.
Yeah.
Different forms of arthritis. And you're a hand surgeon, and you see the differences between osteoarthritis and rheumatoid arthritis. So as a hand surgeon in that type of area, what can you share with us, the differences between those two and what are some of the things that you do as a surgeon to help people improve the use of their hands due to different forms of arthritis?
Well, sure. I think you should know that the reason probably I became a hand surgeon, I talk about it in my book in the very first chapter. My grandmother had crippling rheumatoid arthritis. So rheumatoid arthritis is a systemic disease, right? It actually has a genetic HD4. These genes are involved, and it affects the soft tissues, which secondarily affects the joints. Whereas osteoarthritis is a primary spontaneous joint wear of the cartilage, of the lubricating surface. Actually, nobody knows what causes osteoarthritis. We still don't know if maybe there's an occult virus we don't know about, right? I shouldn't use the word virus right now. But,
That's a dangerous term today.
Yeah. Yeah, so we don't know what causes, but they're very different conditions. Osteoarthritis is much, much more common, fortunately. And osteoarthritis affects multiple joints and has a predilection for certain ones. For example, the little joints in the fingers, when you see people with the little joints that get these little knobby, those are called Heberden's nose. They're basically, it's just called bone spurs. And that is typical of osteoarthritis, whereas rheumatoid arthritis affects a lot the soft tissues. So the tendons start to move or drift. The fingers actually deviate. And there's a lot that happens. And in my book, I talk about how I went to visit a hand surgeon in New York when I was 8 years old with my grandmother. But I won't tell the story any further, so your viewers have to buy my book.
That's right, and it's a fantastic book too. Healthcare in the Trenches.
From the trenches, yes.
From the trenches, that's right.
Which talks in the first section about my evolution. Like many physicians, we're inspired by a variety of things, and then once we get into practice, about all the challenges. But getting back to arthritis, there is obviously conservative treatment not so much for rheumatoid, but for osteoarthritis. A lot of studies show in the very early stages that a glucosamine and chondroitin supplement can help. And I've been taking this for years, by the way. I just take it as like a vitamin. And then I also use turmeric a lot because it's a natural anti-inflammatory. So these are things that maybe can keep the symptoms in check. Therapy helps because you strengthen the muscles surrounding that joint that bear the load, particularly for the lower extremities. In the upper extremities, it's not about load. I mean, unless you're a Cirque du Soleil patient, right? I treat those guys. Yeah. Those guys do amazing things on their hands. But osteoarthritis will affect, obviously, ambulation or walking, right? But it also affects the hands and the arms. So I do a lot of, say, shoulder replacement, because they basically lose a cartilage and then they really can't even raise their arm. So we make sure it's not a rotator cuff problem. You see it on a plain x-ray. You don't even need an MRI. It shows you on an x-ray. And then I do an outpatient procedure where I actually put a little cap of titanium, boom, right on I remove the bone spurs, I put this cap on, and they're starting rehab within 48 hours.
Wow. Now let me ask you a question, because this is something I've never heard of when it comes to, you said shoulder replacement. Is that in the same line as someone having a hip or a knee replacement? You can actually replace that joint?
Oh yeah, and it's been around for decades. It's just that it's much less common. I mean, I think last year we did maybe in the US about 600,000 knee replacements. I think hip is somewhere around 450, I think, thousand, whereas shoulder replacements are nationally maybe 50,000. Wow. I have a lady I need to do a wrist replacement. Rheumatoid is more common in rheumatoid, and in rheumatoid wrist replacement, there's less than 1,000 done a year. So these are things that the public isn't exposed to, and even the insurance companies, which is a whole nother topic. The insurance companies are now covering not only knee, but also recently CMS approved hip replacement for outpatient, meaning if you go to an ambulatory surgery center, you can have that joint replacement, and CMS or Medicare will pay for the implant because they realize that it's much more cost effective. Yeah. And there's no MRSA, right? The bacteria, not to mention COVID. Yeah. So we're seeing a transition to all of these type of joint replacements, even in older individuals. as outpatient because it's safer and it's more cost effective. So these are the things that our healthcare system needs to gradually move into to bring down the cost of healthcare.
Well, let me ask you this because, and I want to get into your book, but I want to ask you about these clinics that you've created called Ortho Now in South Florida. What is Ortho Now? And when someone walks into one of these places, what do they expect and what's the advantage?
Well, the key is what you just said. They can walk in. So imagine right now you have severe back pain. Maybe you went to your chiropractor and it's just not working. You need a more thorough diagnosis. You can just walk into one of these and get an assessment by an orthopedic clinician. Now, sometimes it might be an MD. Many times it's an ortho PA. Why? Because if you have somebody like me, I haven't examined the back in 25 years. So you want somebody who every day is seeing the common things that would walk in, get them worked up, get most of them treated. And if something is potentially surgical, then I have communication with this. We're on our 4th generation of the Ortho Now app, which I suggest people download. In that Ortho Now app, the surgeon can then communicate with that clinician and say, oh yeah, I need to see that wrist fracture tomorrow, or I'll book it for surgery right from here because we can do telemedicine. So the idea of Ortho Now is to give easy access to the initial orthopedic care. It doesn't displace the surgeon, it doesn't displace hospitals. It's an adjunctive, more convenient and cost-effective approach to getting access.
Well, you're also, in a way, and I say this as a positive, you're cutting out the middleman, because you and I have discussed before where a patient goes to their general practitioner and then it is wait after wait after wait, trying to get approved to go see a certain specialist. The time when they need help now is just stretched out for so long. They're wondering if they're going to get approved by a specialist to go see them, if their insurance company is going to approve their policy or whatever to go see that. But they can literally walk into Ortho Now, skip all of that, and actually get the help they need right now.
That's it. You said it better than I could. That's exactly it. In other words, we don't look. I tell my patients, I'm a physician. I don't know anything about the eye. I don't even know my own prescription. I literally don't know my own prescription. So now that's a very, very refined area. But I can tell you that most well-rounded, very knowledgeable primary care physicians don't know a lot about deciding and understanding what specifically is causing your shoulder pain. So, and then when you go to the orthopedist, that orthopedist may say, you know what, I really don't do a lot of shoulder. I'm really a hip and knee guy, right? So yeah. Ortho Now brings you to the right person if you need it. And many times you don't, because there are simpler problems that we can treat by somebody who sees this every day. We have to get away from this somebody goes to their general doctor for everything, because the poor general doctors, they're taking care of chronic ongoing conditions. They have their own patient population. My mom has asthma and hypertension. They don't need, when my mom had knee pain, she called me, her son, the surgeon. I go, Mom, I think you probably have a meniscal tear with it, but you know what? Call my friend who's the next town over from you in New Jersey, and he scoped her knee, and she does ballroom dancing, and she was back dancing within 5 weeks.
Wow.
This is the sort of thing that healthcare should be doing, and insurance companies shouldn't be the word you used about approving or authorizing. That makes no sense. Once you paid your premium, by golly, that's your authorization, right? Now, if doctors are doing things that aren't ethical, over-ordering tests, over-scoping knees, then the insurance company, sure, should have oversight. But they should not be a cogwheel in the process, because all they do is increase their costs, and certainly our costs. And that is what I think in a crux has to change. And that's what Ortho Now is trying to do. And by the way, Ortho Now is open to investors because we want to bring this nationally. And right now it's just, we were in Georgia. We weren't about to open in other states. And then we turned the process around. So we're looking right now for a good strategic partner to basically roll this out across the country.
Wow, that is fantastic. And I may get back to you on that because I think I know somebody. So we'll have that conversation in private. But also, and this is what I love about the Ortho Now, is that like you said, in a way, it's correcting the healthcare system
Yeah.
the way it should be, so
Yeah.
people don't have to be waiting. They can get the help they need right now. Because, you know, my gosh, I've seen people in pain dealing with the wait times from the insurance companies, from, you know, waiting on their doctor to approve. And technically, it comes down to the insurance companies approving who they can see and not see. And like you said, if you're paying the premium, they should be able to get the care right now. And
Well,
that's
it
just,
used to be that way, but gradually the insurance companies have injected themselves into the system where they shouldn't be. They shouldn't be practicing medicine. And I mean, I have a great story in my book about that, about a shoulder patient, and that's why I'm already thinking maybe about the second edition if the book is that successful, because there's so many examples I have of this, and it has to stop because in the end it's good for them. I tell my friends who are in the industry, I go, if the patient's going to get it anyway, ultimately, right? The
right.
patient's going to get the care, but why delay it? All of that delay costs money and makes things complicated. And you know, I get patients, for example, with a very common tendonitis of the wrist. If I see them in the first few weeks, an injection, the literature shows an injection of something like Kenalog cures in 80%. But if they come later, most of them then need a procedure. And the procedure is very easy, but the procedure costs more money than an injection. So why not let the person who's the expert decide what the treatment is? In the end, we want to practice cost-effective medicine. I mean, most doctors are very ethical people, right? We've been screened for the 15 years. You know, you don't get through medical school and residency if you're a charlatan, right?
That's right. That's right. Now,
There's bad apples everywhere.
I know, but let me ask you very quickly here, because you wrote a book called Healthcare from the Trenches. And a lot of the things that you have discussed today are actually in this book. What else did you write about in this book for all of the readers and my viewers to buy a copy and to learn more?
So if you don't mind, I'm going to have a little cheat sheet. I happen to have one on my desk.
That's
I
all
actually
right.
only got my copy last week, believe it or not, because Amazon does it as orders. So whoever goes to Amazon just types in Healthcare from the Trenches. If you want the soft cover, it could be 10 to 14 days. And I'll just cheat here and look. So section 1 is about my preparation, and section 2 is I think what readers will be really interested in. Okay, and the first chapter is about government interference, right? So in other words, with the government, and now it's an election year, the government needs to work with us, not be a barrier to providing the healthcare, right? Then the next chapter is about hospital systems, big healthcare systems. Look, we need hospitals, right? But you don't need to go to a hospital when you have an ankle sprain, or you even have a little minor wrist fracture. You don't need the hospital for these things. Chapter 9 is called The Big Business of Health Insurance. That one, I got to check my brake cables on that one. And then chapter 10, it talks about opportunists cashing in on a system. I mean, look at the billboards that you go down your highway about, injured. I can't even tell people on my website, I can't use the word injured because even though I'm a trauma orthopedic surgeon and a ham surgeon, injured connotes a legal problem.
Oh my gosh.
But when you think about it, right? So what do you see? The billboards, they say, injured in a car accident. Well, to me, you need a doctor. Then you might need an attorney because you may deserve compensation, right? But we shouldn't start with the law part, right? And then I talk about medical malpractice. And then the last section, I talk about, we use the word about physician burnout. Physicians are not burned out. Physicians are really, really very resilient people, right? We go through this training. That's not a problem. What we have, and I use this phrase that was first put out by a physician called moral injury. It's like being a soldier and going to war and being asked to kill civilians when it's morally against you, right? And there's an internal conflict with that. Well, when I see a patient and the insurance company is not letting me do what I know in my training is best, that causes a moral injury, which is incredibly frustrating, very frustrating. I talk about that. Then I talk about physicians and money. There's a lot of misperceptions with the public about the economics in healthcare and about physicians. I mean, the incredible costs we have to run a practice. And then the last chapter is where do we go from here? And it's not just me. I have 27 contributors to the book. Wow. So I'm going to give you a a snapshot of what a lot of different smart people who are in the trenches think about what steps we can make to get healthcare more cost effective.
Well, wow. Ladies and gentlemen, Dr. Alejandro Badia, Miami, Florida. Definitely go to drbadia.com. Look him up. Buy the book. Go to amazon.com. Healthcare in the Trenches. Here's the thing. On my show, we desire to give you knowledge. Why? Because knowledge is power. You know, everybody goes to the doctor. A lot of people go see Dr. Badia. The thing is we need to have that knowledge of the healthcare system. Just don't be stepping into it and not understanding how the system works. We need to understand how the system works, because then we'll know what to do. And at the same time, you know, we need to team up with healthcare and make it better. And that's what Dr. Badia is doing. So for all of you who are in South Florida, maybe you're in North Florida, and you need to check out Ortho Now. Any last words, Dr. Badia, that you would like to share with my viewers?
Yeah, I think that we are the end users of healthcare, right? All of us, right? I had my shoulder done. I had my left knee done. I need to go get my colonoscopy done. Reminder.
Been there, done that.
Yeah, it's been 5 years, so too much information, I know. But the point is that we are all consumers of healthcare, and you need to understand it. You need to spend as much time researching, for example, the person you're going to see as you would choosing a plasma TV or even your automobile. I mean, this is somebody who's going to be working on you. For the book, you can go to drbadiabook.com. By the way, that's a newer URL.
Okay. All right.
drbadiabook.com or to my website or search it on Amazon. But the point is just, you know, get educated. I love feedback, by the way. I personally, I still respond to emails that come through my website. So if somebody has a question, I do my best to answer it myself.
Oh, fantastic. See, I do the same thing. I give out my email address to all of my viewers. They send me health questions. I try to guide them in the right place. And I can tell you one thing, Dr. Badia, for anyone that's going to ask me a upper extremity problem from the hand to the shoulder, they're coming your way. So ladies and gentlemen, there you go. One of the greatest guests I've had on the show, Dr. Alejandro Badia. He's an orthopedic upper extremity surgeon in Miami, Florida. And for all of you, regardless if you live outside the state of Florida and you really need to see somebody that you know you can trust to give you the right information about the medical care that you need for your problem, please go to drbadia.com. And I'm Dr. Ward Bond, so stay tuned with me because I'll be right back after this message.
I'm Norm.
I'm Saz.
And we live in Columbia, Missouri. We do consulting, but we also write.
We take care of ourselves constantly. It's important. We walk 3 to 5 times a week, a couple miles at a time.
We've both been taking Prevagen for a little more than 11 years now. After about 30 days of taking it, we noticed clarity that we didn't notice before.
It's still helping me. I still notice a difference.
Prevagen, healthier brain, better life.